Good? Are we
Yeah.
good? Mm-hmm. Cool. Wow, look at this. I'm so happy. Thank you, everyone, for coming. How many of us, I think this is a lot of your guys' first times here. Not yours, not yours. Everyone else. Wow. It's crazy. Hi, Daniel. This is Jess, Dr. Amador, and this is our acupuncturist, Crystal. And today, any guesses about what we're going to talk about?
Lower back pain.
Yeah, wow, that's pretty good.
Very good.
So if you guys don't know, his mom's also a chiropractor.
Really?
Yeah.
Oh, wow.
And he asked her, he's going to give a talk about low back pain. What could it be about? And she goes, I don't know. It could be about so many things. So that's exactly right. We're going to be talking about a few things. I'm going to try pressing this. Are we still filming? Are we good?
You're good.
Cool. Hopefully this nothing. All right, before we get into it, what do we know about back pain, pain generators, anything at all? Just talk to me.
Does it have to do with posture?
Okay, definitely could be.
Can it be fixed with a lifestyle change?
Very good. Anything else?
You said pain generators?
Yeah, what causes pain? Things that generate pain.
Receptors?
Okay. I like the very technical answer. I know we got some med students and soon-to-be med students in here. Name things that can cause back pain.
The weight you put on your back, maybe?
The way you put on your back?
The weight.
The weight you put on, like a backpack?
If you're like top heavy.
Oh, weight. Okay, weight management.
I feel like height can have a lowness.
Sure, absolutely. Like the shorter you are, if I'm like shorter than you and I'm benching more.
Yeah,
Or if you're
like
taller and you're benching more,
tall people
it's
have
harder.
that
Yep,
problem.
absolutely.
Car accidents.
Yeah.
That's very good.
Bad posture.
Bad posture.
Short leg syndrome?
Short leg syndrome, absolutely. This is DL right here.
Oh.
What about like, what else? You guys are thinking two in the box. Weak muscles. Still two in the box. What else can, what are, anything that
Maybe
can cause
you're
back pain?
sitting at a desk and you tend to lean like this a lot because this arm still needs to be holding a mouse.
It's oddly specific, sure.
And then your
Or you sit like
outside
this
the
because the
box.
chair's not.
What about
And
like
your
a-
QL gets shortened.
What about like a kidney infection?
Oh, like
That can cause back pain.
You mentioned muscles.
Yeah.
Dehydration.
Dehydration,
Overhydration.
sure.
Right, appendicitis then. You wanna
Appendicitis, yes. Absolutely. Or like AAA. I know you know what that is.
Yeah.
Back pain.
I already said car accidents. I don't know what you're
So there's a lot of things that can cause back pain. But for chiropractic, PT, and most conservative care modalities like acupuncture, what we're going to be talking about today is what we can treat. And we can identify, should I go to a chiro, should I go to an acu, can they help, a PT, or should I go to a DO or someone more invasive. So before we even start, we're going to talk about some other therapies really quick, and I'm going to give the floor to Crystal.
Alright. Thank you. Hi guys, nice to meet you all who I haven't met before. So I'm just gonna briefly be going over a little bit of ear acupressure. So we all know that about acupuncture, how there's a bunch of points on the body. There's also points on the ear as well. And the cool part is about the ear is it is like a map of the whole body. So so this picture's a little bit inverted. I know you can't read it, it's a little bit blurry. But if you were to imagine a baby in fetal position, upside down, that's how you could map the whole ear. So basically, down here in the like lower lobe area is gonna be the head, the jaw, the eyes, ears, everything. Then you're gonna go up to the shoulder area, then to this whole area is the spine. So then you go back to the low back area, the legs, and then all the internal organs are gonna be at the deepest part of the ear in the center. So how this relates to today is whoever wants to participate in this, I'm gonna be doing some ear seeds. So I'm gonna be just going around to each of you and putting a little ear seed. They're made of gold, so it shouldn't be too irritating. I'm just gonna place a little sticker on the point for the low back. So anybody that has low back pain, what you can do is you can gently massage this point, close your eyes, just kind of take deep breaths and just kind of massage it through the day. Not too hard though, because these are hard little beads, so they will indent into your skin. So just lightly tap it. So there's all kinds of reflex points on the ear. For people at home, if you want to hit some of the acupoints, what you can do is get a little tennis ball, get a wall, and then just put that tennis ball and roll it out on the wall, because there's all kinds of acupoints on the low back and the hip and the glute area. Just be careful of the spine. Just do it on all the muscular areas, and then you could release some of the points. And that's pretty much it. And then, so as far as acupuncture goes, what else that we can do for back pain is not just acupressure or needles, but we could also do herbal remedies, cupping, scraping. So for people who, play sports, cupping, scraping, all those things are really nice techniques. So are there any questions before I start putting the ear seeds on everybody? Yes.
Is that a skeleton?
It is, yes. So the skeleton is an image to show all the points on the ear. And it maps that of the whole body. So yeah, so this is the spine area, and it kind of mimics the look of a baby in fetal position upside down.
Cool.
Yeah. All right, so I'm going to go to each of you, and I'll start placing the little beads on each of your ears. If you prefer not to have any gold beads, then just let me know when I get to you. No more
It's
questions?
free. Don't worry about it.
It is free. This is true. All right. As I'm doing that, I'll throw it back to you guys to continue.
Before we do, I'm gonna use you guys for some Instagram clout. So we're gonna be filming random parts of this. So looking like all right.
Look alive.
Look alive.
So I gave you guys a
Trying to
little
get
alcohol
a little bit
swab
of,
on each of your
Dan's
chairs.
ear
If you guys don't mind swabbing your ears before we start.
I'm gonna take your mic, if that's okay.
Yeah.
Grazie. Good job.
Both ears. And if you don't want to do it, just don't.
Do you have more?
All right. While she's doing that, while you guys are swabbing, I'm gonna put a picture up on the screen, and I want you guys to just. We're gonna take a few minutes, and we're gonna look at this picture, and you guys are gonna tell me what you see. You guys ready? No pressure.
Go ahead, Kristen.
People
All right.
walking.
We'll give you guys a few minutes.
Hello.
What's your question?
Just tell me what you guys see.
It's not gonna hurt.
She's
You can get closer. I know the here. We can turn off the lights really quick,
It's a crosswalk.
Did it hurt?
just so you guys can see. Wait 10 seconds, Daniel. Wait 10 seconds so that we. It's gonna turn off then. It's okay. Let's leave it.
Can I? Oh, turn the light.
Not yet. We're gonna get some of this first. Did
Sorry.
you put yours in or do you not do it?
Do I rock it?
Oh, that looks like a pimple about to come out.
Well, I don't rock it.
It looks like a piercing.
No, it looks good.
He's messing with you.
Oh wow, that side looks good. And so I think she said this, but don't be like jamming it into your ear, but like a little bit of pressure, like a little ear massage.
Because it will indent a little bit.
Yeah.
And you could take these off after 3 to 5 days. You could swim, shower, sleep, everything.
And it's gold
Yeah.
plated.
Probably.
All right. I think that's.
Go ahead.
You think that's good, Jess?
Yeah.
Or Dr. Jess?
There.
All right. Turn off the lights, Daniel, and let's look at this picture. And you guys can
Oh,
take a look
okay.
and see what you guys see. Oh, that quality is so much better. A crosswalk, okay. Daniel, just sit down. Sit
I
down.
got you.
Thank you.
Do you want me to turn the lights on too when you're done asking the question?
I can have Marvin do that. He's closer to it.
I see bad posture.
Bad posture. I like this theme.
People.
People.
Dragging.
Is
Someone
this
has
supposed
a
to be an
roll-
analogy to a spine?
bird's eye view of
No.
people walking.
Bird's eye view of people walking. Very specific. I love it.
Someone is rolling a bag as opposed to carrying
Good.
it. Someone's carrying a bag with one hand as opposed to distributing the
All right. I'm gonna ask 2 questions. The first one is, where do we think we are? Where in the world are we?
New York,
A dense city.
Japan.
New York. Why do you say New York?
big crosswalk.
Okay, big crosswalk. Why do you say Japan?
Big crosswalk. Asian
Oh, these are a lot
Asian.
of pedestrians.
Okay.
So it's a society that focuses itself on walking.
So no, but you say that half mockingly, but truly, we can eliminate like a lot of the less industrial countries, right? Because they probably don't have nice large crosswalks like these, or people are dressed pretty modern. It's probably not some remote tribe in Africa. So we can we've gathered it. It's to some modern country. I heard Japan.
I think it's Japan as well.
Why?
Everyone has, typically has a darker color hair and then
Sure.
stronger gray. Just a typical, phenotypic.
What do we think the weather's like?
Raining.
Why raining?
There's an
Oh,
umbrella.
there's umbrellas.
Yeah, but this guy's in short sleeves and shorts, short sleeves shorts,
It could be humid.
shorts.
So it's going to be tropical.
Or maybe it could just be sunny. It kind of goes back to that Asian country. Sunny, someone's holding an umbrella to avoid the sun. right? But maybe it is a little bit cloudy because I don't see any shadows, right? Right? Okay, so second question, and before you guys start shouting out answers, we're just going to think, when was this picture taken?
Like time of day or
Give me
A year.
within a 5 year, give me like a range of years.
2005.
Mid-20s. I mean, sorry, mid-20s.
Early 2000s? Okay. Why did you guys say that?
They look reasonably modern, but nobody's looking down at their phone.
Oh,
I love
very
that.
good.
That was exactly what I'm going for. Okay, so early 2000s. Well, you kind of gave it away.
I'm sorry.
It's okay. You're too smart. That's what freaking we get for DOs. There's, absolutely. What's one thing that? How many of us noticed that in the very beginning before I even asked the question?
nope. Did not notice.
Right. So how do we think this correlates to pain? Why would I show this picture for a low back pain seminar? It's gotten worse from looking at your phone? That's funny. I like that.
I'm not sure right now.
We can turn. Yeah, thank you. Oh, so bright. Yeah, same reaction. So, pain is complex and it requires a bird's eye view, kind of like how Nancy said in the beginning. It requires a bird's eye view of the entire system. Fetty can be coming to me like right here hurts. Okay, I don't care that right there hurts. The pain can be mitigated from your shoulders, your glutes, your knees. There could be so many reasons. We got to look at the entire thing. So throughout today, that's kind of what we're going to be honing on. Some people are going to be talking about, well, it's a mix of how flexible you are, how strong your core is, how strong, if you've had a previous injury or fatigue, or you can even go into, I know some of you will like this, the actual muscle fibers and how that's going to work, or, tensile strength and resting length and all of these things. And, what the heck does this all mean? If you guys can't see that well, this guy is a guy that tore his pec and is looking confused. And you can see just how gross and ugly all of that stuff is. So how do we break down all of these formulas that we have about pain in a way that we can kind of understand? There's two factors. Anybody want to give it a guess?
Wait, what?
If you had to create an equation for pain, what would that equation be? Very long?
How does it limit your other movements? Or like, how does it impede on your day? Because like, if you stub your toe, yeah, it hurts, but it's not like you just got your leg chopped off.
Okay.
Like there's an intensity.
I like it. Kind of. So we can break it down into two things. Oops. Hello. There we go. Stress and tissue. So, for example, you stub your toe. That's an abnormal stress on regular tissue. Tissue can be like bones, muscles, joints, hard tissue, soft tissue. So, some type of stress on relatively normal tissue. So, this is where we kind of get the basic equation of this all. Now, the kicker comes, I kind of gave it away early with the misclick. Anybody catch what that word was?
Abnormal.
Abnormal. I love it. So, the word abnormal. And abnormal goes over abnormal stress on regular tissue can be pain. Regular stress on abnormal tissue can cause pain. So just any abnormality. Any questions so far about this? For example, we're talking about, what were some of the pain generators we talked about in the beginning? We talked about posture. We're sitting like this for 8 hours. This is an abnormal stress, right? And in this point, this is abnormal tissue now. Or if we're benching something, right, and it's, we're not all feddy and we can't all bench, 515, right? That's an abnormal stress on regular tissue. Or let's say we did tear something and we can't even pick up a water bottle now. That's normal stress on abnormal tissue. Any questions so far? Cool, so now we're going to actually talk about the four main pain generators. Before we get into it, does anybody want to guess what they could be?
What is abnormal tissue?
Abnormal tissue could be like if you did tear something, or if you stubbed your toe, or if, something's a little bit tight and just for some reason or another, you weren't working as well as you should have been. Okay, I'll back up. Thank you, Daniel. Any,
You're stressing him out.
me?
Yeah.
I know, look at him, he's like, before we go into the next slide, any guesses about the pain generators? Pain generators?
This
Yeah.
is about them for what?
What are some pain generators? So we talked about posture. I want now anatomy or some type of, is it nerves? Okay, that's one. So we have 4. Nerves is definitely one. Discs, that's a great one. That's the second one.
Maybe the muscles in your lower back.
Muscles, great. That's the third one. Look how easy this is. You guys are all
There we go.
bones or joints. Absolutely. So what were the 4? We kind of got them out sporadically. Nerves,
Bones and joints.
bones and joints, muscles,
Disc.
and discs. Look at you guys. I don't even need the next slide now.
Oh, we were right.
You were completely right. 4 main pain generators. I guys can't really see. Do you mind, Marvin, turning off the lights for like half a second one more time? Are you guys not entertained? So the first one, musculature. So we have you mentioned the QL. We have so many muscles in our low back. It's so easy to we're doing Romanian, whatever it might be. We piss something off, right? That could be we kind of pissed off a muscle. I don't know if you guys can see here, we have these little holes in our spine.
How does this affect your back?
How does what affect your back? Oh, so if you're paying attention, Daniel.
Well, like, specifically.
Sure. Do you want to take that one? That's a great question.
Yeah, so specifically it hits the nervous system. So it has an effect on the nervous system, and these points are self-regulating. So when you put any point for the back or the neck or wherever it is, it's gonna help regulate whatever the issue is. If it's stiffness, pain, swelling, whatever it is, it's just gonna self-regulate it. So, yeah.
How long do you keep this?
About 3 to 5 days. Yeah. And if it's irritating, you can take them off sooner. And yeah, just remember to tap it and breathe into it. And yeah.
Cool. Thank you, Crystal. So we're going to talk about the first pain generator. Oh, before we even go on, I can't believe I forgot about this. What's the funky thing about pain? As I'm sure you can attest 1,000-fold over, so can you. And so can you. Pain is often the last thing to appear and the first thing to go away after some type of injury or stress. So we can wake up in the morning, again, for musculoskeletal related stuff. My back hurts. Well, your back hurts because of a combination of things that happened before, and finally it culminates to, okay, now I feel pain. And then you come to see someone like us, and we can make the pain go away, but is that the root cause of what caused the pain? No. So pain is often the last thing to show up and the first thing to go away. So getting seen relatively consistently in a way that an honest provider is like, you need this, and gives you exercises to go take at home and to improve, that's going to affect the root cause of what even brought up your pain in the first place. So to start, muscle. I know I have it on the board here, but what are some causes? If I cover it, I'm going to stand right here. What are some causes for muscular pain?
Soreness from
Okay.
weights.
Weights, absolutely.
Trauma.
Stubbing your toe, trauma, very good. You can also read, you can,
Posture.
who said posture? I think I heard it over here.
Posture, yeah.
And dehydrate, very good. Very, very good. That's,
Diet, nutrition.
what was that?
Diet or nutrition.
Very good. So a lot of things can cause muscular pain. Biopsychosocial. So this is like a phantom fifth pain generator. So there's 4 anatomical ones, and the 5th one it's kind of in your head. And oftentimes, as I'm sure you guys will experience soon, and I'm sure as we've seen, sometimes patients want to come in and they just want to talk, and they just have a lot of stress going on in their life, and just them unloading some of that stress, they feel better, because that pain, it manifests like stress in their head can have increased tightness in the traps, and it's like a vicious cycle.
So, but you would have to go psychologically into that too, right?
Yeah.
Not just
So we would work closely with trusted psychologists. What's going on with that? And sometimes all they need is someone to just they need 10 minutes in their life to just sit down in a calm environment with someone to just right here. That's and kind of going from there. And then so some symptoms. This is the beauty of what we do. Like, I'm a nerd and I love this. So muscular pain can be so tricky and so classic. Like, sometimes it can just be a local pain, like, or it can just be soreness or tightness. Sometimes it can travel, like your glute medius have referral pains down your leg or towards your hip, and it's like, no, I know you feel your pain here, but it's this sucker right here. And when I press there, my favorite one, I don't know about yours, my favorite one is your suboccipitals here. Because once you work on the suboccipitals, I think you might have experienced it. You push down on those muscles, sometimes people feel things behind their eyes. And that's just the gnarliest thing, because we can affect and improve their headaches. They're not feeling it as much because we're working on these muscles. They have tension type headaches, and you press here and it's like, oh, that's my pain. And it's gone. So referral patterns are huge, and it's so fun to play around with and find out. And also weakness. If we tore something, I'm not going to be able to lift this up if I have a torn bicep, right? And there's types of tears from like partial thickness to full thickness, but despite all of that, weakness is another factor. Just to recap, we got soreness, tightness, local pain, radiating pain, and weakness. Any questions about muscular stuff so far? Okay, I know I've been talking a lot.
How do you fix it?
Oh, I was going to throw the floor to you,
Oh,
but not yet. So this is some of the referral patterns I was talking about. So we got like your multifidi coming up to the top of your head. You got your traps that can refer all over your low back, all over your mid back, all of that fun stuff. How can you fix it? That's a great question. In our session, you asked me a question. I don't know if you remember. It was, can you exercise for most things? And there's going to be a theme with today. Exercise, exercise, and can you guess the third one? Adjustments in soft tissue. But I love your enthusiasm.
Talking about when you're doing the cups, exercising with the cups.
So absolutely. So even if you're doing soft tissue therapies, there should be some movement involved to actually target muscular issues. I don't know if I was on a podcast and one of the hosts, this is a really lame podcast, but I'm kidding, it's great. It's great. And one of the hosts was having neck pain, and we were able to use exercise. I didn't even touch him to reduce the neck pain. So one thing that we can do, post isometric relaxation. Post meaning after. Isometric is we're loading a muscle without lengthening or shortening it. Relaxation. So for example, the neck is the most easy way to discuss this. If I have pain, turn to the right. Okay? What I would do is I turn to the right just shy of the point of pain. Okay? I put my hand on the opposite side, and with about 20% of my force, I push into my hand this way. And then after 10 seconds, I go a little bit more into the pain. And then push. 10 more seconds and push. So I'm slowly relaxing my way into pain, and this is like the most effective stretching. Studies have shown this is not effective for stretching. Yeah, you feel your receptors activating, but then you're not actually stretching a muscle. We're not actually getting any more movement. But like some type of isometric post relaxation, that stuff is money. So even for acute Achilles sprains or low back sprains, you can do very minimal, very mild post isometric relaxation. On top of soft tissue therapy, the cupping, the scraping, the trigger point therapy, all the adjusting where the muscles insert and attach, all of these things have been shown to be very beneficial. And there's actually a study done, I know you guys may not care, but it's really interesting, that there was a test and they looked at inflammatory markers, pre and post adjustments. And they found that one of these inflammatory markers were decreased post adjustment. So if our muscles are irritated and inflamed as is, then an adjustment will also decrease some of these things. Any questions about how to treat muscle pain or how to identify muscle pain? Generally for the traveling pain, you press somewhere on the muscle and it travels somewhere. It's not like you have that constant linear pain. Question?
How does that stretching that's not the isometric,
Yes.
does that help?
That's a great question. There was a study done about a year ago, and it showed that isometric exercise is almost like wringing a wet towel. So it wrings out old interstitial fluid or poor inflammatory things, wrings out of the muscle and allows for new things to come in. The new oxygen or whatever it might be. So that's kind of why the isometrics, it's equivalent to wringing a dirty towel, and all that gross stuff is coming out, and when it realigns, it's able to be refilled with better fluids.
Is there a limit to how much you should push yourself? Like if you're feeling extreme pain, like sharp pain, should you stop? Or
That's a great question.
the threshold?
For isometrics, generally, if in my opinion, and if other providers disagree, by all means, please. If pain gets better, keep going. If pain stays the same, keep going. If pain gets worse, do a little bit more. See if it still gets worse or if it starts to baseline. If it still gets worse, then back off. That's generally my metric. So if we're doing something like, it feels the same, great, let's do it again. Still feels the same, good, let's do it again. Until we either get better or worse. If we get better, great, this is what we're supposed to do. If it gets worse, it's like, all right, let's do a few more. Let's make sure that that's why it's getting worse. And then if it constantly stays the same, then in that case, maybe this isn't the right exercise for you. Let's go back to the basics. Let's retest and figure out what's going on. Great question. Anything else? All right, I'm going to throw the floor to Dr. Jess.
Okay, so our second type of pain generator is going to be nerve irritation. As you can see, there's 3 different types of causes that can cause that nerve irritation. We have compression, inflammation, and neural tension. So compression of the nerve itself can come from a couple different things. It could be disc, could be stenosis. Does anyone know what stenosis is? Stenosis is when the canal right here is narrowed, causing irritation to the nerve. Got a question? You need Greg? So compression, inflammation, neural tension. Okay. Any type of nerve irritation that we have, we normally get traveling pain, and it could go from the low back to the glutes, or the low back all the way down to the feet. You can get numbness and tingling along with weakness.
What the heck does that mean?
What does that mean?
How do we treat it?
Sorry?
How do we treat it?
I also forgot to mention that there is a disc in there too that can bulge. I think Greg kind of mentioned it. That can hit the nerve root and cause that irritation of the nerve. And again, it can travel down as far as down as your feet.
Yeah?
Sure.
All right.
Go ahead.
All right. So for nerve stuff. Sorry.
No, you're good. This is your baby.
How do we treat it? Did you talk about this?
I didn't.
I was done dealing with my brother. This is my brother, if you guys don't know. Do you mind, Marvin or Freddy, actually turning off the lights for like 10 seconds? Thank you. So, do these people look familiar to you guys?
Yes.
We all know that handsome devil, but what about this one?
That's our acupuncturist, Crystal.
Crystal. So, for nerve tension, one of the best things we can do, so we're talking about nerve root pain. We're talking about the low back. What's one of the biggest pet peeves you have about patients with certain nerve pain?
Oh, so one of my biggest pet peeves with nerve pain, or specifically low back nerve pain, is when they come in and they talk about them having sciatic nerve pain or diagnosing themselves with sciatica. And the reason why, it's misinformation. To have true sciatica, you have to have something compressing the sciatic nerve, which originates in the glute itself. So you can have sciatica by having the piriformis muscle, irritating that nerve. However, the nerve irritation in the low back, since it starts in the low back, it's due to something other than the sciatic nerve. So it could be a disc bulge that's irritating the L5 or L4 nerve root. So that would be the diagnosis. It could be stenosis of that canal that's irritating the nerve.
Those
so then,
holes.
Huh? Those holes,
yeah.
yes. So then that would be, the stenosis would be the diagnosis. It wouldn't be sciatica.
Yeah.
So that's
The biggest thing, especially like, I'm looking at the DO right now, but oftentimes, not him, because he's very smart and he's also doing something totally different. But
all DOs are smart, right?
some
You are. That's right.
so many times people come in, oh yeah, my primary diagnosis is sciatica for my low back pain. Oh, hold on. So you guys can see these holes, right?
No.
I don't know where the yellow's coming out. You guys see this right here?
Yes.
The hole.
Yeah.
Okay. Now, if there's irritation because these joints there's bony overgrowth or whatever, how can we make that hole bigger? Okay, so you guys see this hole right now? If I bend forward, did that hole get bigger?
Yes.
Yeah, look at that. If I go this way, that hole get bigger. If I go forward and that way, did that hole get bigger? Yeah, that's the biggest. So we can mimic this. Of course, we're talking millimeters, centimeters here, but these millimeters and centimeters make a difference. So in this picture with our lovely acupuncturist, if you're on your side, and then you throw your hips over the table, we got this portion down. Yeah, you see? It's the same thing. And then we can laterally side bend, and make that hole the biggest to alleviate any irritation from the nerve root. So oftentimes people come in with like a pinched nerve. I don't know what to do. Everything just hurts, burning pain going down my leg. Take a second. Let's get you on your side. Throw your legs over the table, kind of in this position. And we're going to go over this in a little bit in one of the exercises we're going to go about. Any questions about nerve-related issues? No questions?
Yes.
Yes,
But this is kind of complicated.
That's fine.
Random.
let's do it.
I think I asked you about this before.
All right.
Like when I, like there's times where I'll be pressing heavy weight and I'll feel a vibration right here.
Mhm.
My nerve.
So you have a lot of different tunnels and holes that your nerves go through. So as you're pushing a weight, oftentimes you can compress those muscles just by, if we go back to that one of the first few slides about injury, now you have abnormal stress on normal tissue. So that's why you feel that. You have a weight now that's, if you have a hole, and again, it's not going to look like this, that all of a sudden because of weight is slightly smaller or just more irritated, you're going to feel that weird sensation.
My solution to this always is to just keep going. Call it a day. Is that good or no?
Does it have long-standing pain?
No.
I really don't care then.
Okay.
As long as it doesn't stop you from doing what you want to do, that might be a good reason for you to come to us and we kind of beat up your arm. This is my favorite type of pain ever. It's the scariest sounding. Doc, my primary said my discs are problematic. Or so many times people at the gym like, oh, I know a guy that pulled his, like he herniated his disc deadlifting and I don't want that to happen. Now I feel like a little bit of tightness. I'm worried it's like going to be me. Discogenic pain is the scariest sounding non-thing. It's pain that comes from our discs. Discs can cause pain. It can cause referral pain, a dull, local achy pain. There's actually a song that we learned in school. You guys don't learn it. Lots of D's. How can you identify? You look really excited for this one.
I really want to learn it.
Yeah. So the song for disc pain: deep, dull, achy, hard to localize, diffuse.
Do it again.
Deep, dull, achy, hard to localize, diffuse.
Again.
All right. Let's hear it. Do you guys want to give it a shot?
One more time.
It's gonna take a while.
Deep, dull, achy, hard to localize, diffuse. So it's
Hard to localize.
hard to localize.
Like heart? I thought you said achy hearts. Yeah.
Achy hearts. Well, I have. Anyways. Do you guys want to give it a shot?
Yeah.
All right. Let's get them on.
One more last one. Then we'll do it.
I'll say it with you guys. Ready? 1, 2, 3. Deep, dull, achy, hard to localize, diffuse. Very good job, guys. Wow, that's incredible. So yeah, look at that. So if you guys have like a deep, dull, achy pain that you can't like, it's kind of moves here. It's probably your discs. One of the best things we can do. What has been the theme for today? Body movements. What's the best thing we can do for disc pain?
Exercise.
Dull, achy.
I love that. Exercise. All right. So disc pain is often worse in the morning, right? You wake up and it's worse. Like I wake up and my pain is worse. As soon as I start walking, it gets better. Isn't that weird, Doc? Not really. That's typical. That's textbook. And also bending forward. So the most common things we hear for disc pain, the most textbook is, I was gardening in the morning and I hurt my back. Okay, it's 9 times out of 10 your disc. Gardening, you're bent forward, poor posture, poor core. Yeah, you're going to piss off your back. Or I was going to get my toothpaste and I was brushing my teeth and I bent over to turn off the sink and I pissed off my back. Bending forward in the morning, deep, dull, achy, hard to localize, diffuse. All right? Disc pain. Now, the good news is this is some of the easiest things we can treat. Almost everything works. So yeah, we can do the cupping and have you do some movements, some scraping, some manual release on the affected muscle, because our discs are now inflamed. It's going to have some referred pain, and the area around it might also be irritated. But to actually get to the discs, I had both of you guys. You do this for sure. I don't remember if we got to do it yet. I did have you do it. It's backwards bending.
Yeah, no, I remember you.
I made him do it.
You did it to him, but you told me I was gonna do it, but then you.
Yeah, I wasn't thinking. Yep. Yep. And then also core. You know how many times? Can I get a volunteer?
Come on, go.
Let's get you on your back. So he may or may not have pain. He's just a random person in the audience. But here, let me hold on, bring your head up. Let's get you a little bit comfortable. There we go. So many times I'll have a patient and just testing him out, I'll bring the leg up. Relax, bend your knee. Okay, your belt's upside down, by the way.
Really?
Yeah,
Oh, that's unfortunate.
I know. I come here. Any pain? And you come here. Look at that.
I don't like that.
Yeah, I know. Can I get another volunteer? Come. So you're going to come around me and you're going to stand right here. You're going to pretend to dive into the swimming pool. You're going to just put your hand here. Okay, and you're strong. So Danny, push down as hard as you can on his hand. Not yet, when I tell you to. So we're going to come here. Yeah, you ready? I mean, you don't like that? Push. Push. Better, worse, or same? How's your pain?
Better.
Better? Whoa, why is that? Was it actually better?
Yes.
How much better?
It was significantly
Good.
better. Not like.
Yep. Yeah, if you want to get that better, you actually have to come get a treatment. But any ideas as to why that might have been better?
Yes.
Why?
Core.
Core. I love it. Where's the spine? So our spine is the posterior third of our back. The anterior 2/3 is all air, organs, gooey, gushy stuff. But we have air and we have our abs to kind of provide stability. So, but when Danny was pushing down on Fetty's arm, he was engaging his core really hard, and he really pushed. I saw you struggling, and you're like a big guy.
He was pretty big.
I know.
Strong.
He's a sleeper. Pushing. So by engaging air, we're able to stabilize our low back. Now that there's more good stiffness, there's more space for our discs and joints and nerves to breathe, because we're able to give it a nice, solid foundation. But if we're slouched, poor posture, poor breathing, everything's going to just pissed off and pissy. Any questions about disc, nerve, or musculature? Yes.
So I tend to have back pain after I commute a lot to work, and I think it's common for a lot of people who may be viewing this video right now that also have a lot of back pain because of their drive to work. And I don't know how to sit in my car at all. And I think that has something to do with it. Is there any tip you could give on how to change your posture or like your seating environment so that you're not sitting like this when you drive?
So the question was, any advice for people that commute long periods to work on their posture while driving?
I think that's muscular or something like that.
It can be a little bit of everything.
That's what I was thinking.
Long story short, yes and no.
What does that mean?
Exactly.
Thanks. Thanks, Kobe Bryant.
You're welcome. So there's actually something called lumbar rolls that you kind of stick in your low back while you're sitting, and it kind of accentuates good posture. The biggest thing, and I know Dr. Jess agrees with me here, is just movement. If you have a long commute, as soon as you're out of the car, move. Like if you're at a sitting desk all day, get up every half hour and just like move. If you're at a standing desk, move. Sitting for long times, standing for long times, doing anything for a long time is going to be annoying for your low back. It's going to just be annoying for your body. We're not meant to be sedentary. We're meant to be moved. We're meant to be moving. Any
No, I agree with the lumbar sport.
yeah,
About laying down.
move.
I feel like
Is there a specific distance from the wheel you should be?
Whatever's comfortable for you.
I feel like 20. Like, let's say you have a desk job.
Mm-hmm.
You could you could go on walks for 20 minutes.
Yes.
Before your lunch. Like let's say, like for me personally, I'll be at work at 7, and I'll start my work at 9 and 9:20, and then after lunch I'll do around 2.
Yeah.
And then just like walking.
That's the best. That's the best. It's moving. It's movement. What?
So no, actually, I can't take 40 minutes.
You can't think 40 minutes?
All right. Last up. So we went over three pain generators.
Oh, 'cause
Sure.
we just tell them.
All right.
They really tell me. They really don't.
So we went over who remembers the last pain generator? It's also on the board. If you guys can see it.
Joint pain.
Look at you guys. Oh, so smart. So smart. Okay, yes, joint pain. Joint pain is also fun because it's really identifiable. So, have you gone over in your ortho class? Yeah, I'm looking at you. We're kidding. Have you gone over like Kemp's maneuver or Kemp's test?
I don't believe so.
All right. Well, this is a little. So joint pain, especially in the low back, don't like bending backwards. So when you bend backwards, it's ow, 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 ow. It's pretty repetitive. It's like this movement, bending backwards, and coming out of it better. Sometimes it travels, but not too often. We rarely see joint issues. The worst thing is, you get your right hand in your opposite back pocket, and I'm testing the right side facets. So would you mind actually showing them what's happening as I do Kemp's? So my right hand, left back pocket, and as I travel down, if I have joint pain, this is excruciating. I'm bending backwards and rotating. I'm jamming these suckers in together. So if it's a joint-related pain, it's like, that hurts. No way, get me out of that position. Same goes for your neck. Ow, ow, ow. So generally, that's joint-related. Best thing to treat for this, any guesses? This one's probably adjustment, yeah. We kind of just got to create some separation and gapping. Who actually knows what an adjustment is?
So my guess would be that adjusting is forcing mobility into an area. I think that's what you've told me before, but I
Good.
might not have been listening.
That's fine. Now, does that area already have that mobility? Are we moving bones?
I think it's putting it backwards supposedly.
Close. Because we're not really moving bones. So if something's out of place, if a bone's out of place,
Oh,
we're not the guys. Don't see me. If your bone's out of place, don't come see me. Go see her. Go see somebody else. I don't want to. Yes.
moving blood.
No.
Blood
What?
through an area.
Actually, kind of.
Thank you.
You do stimulate a lot of receptors after an adjustment, so in a way that's correct.
The scraping.
That's not so much for. So we're gonna do this together. Everybody have fingers, right? Anybody not have fingers? Cool. How high can your guys' fingers go? Are you getting tired? We can. Daniel, come fill in for her. Daniel's gonna fill in for
I
her.
could do it.
He's also like he'll be great
Yeah,
at it.
don't call me that. I don't care.
He'll do it. Thank you, Daniel.
Like,
You got me in it?
is it using your audio?
No, the audio's from Jacob's phone.
Okay, you're good.
All right. Everybody has their fingers. How high can their fingers go? Wow, that's pretty high.
Are we touching on something like you?
I don't care. Just your. So I see Nancy's is the highest right now. Good job, Nancy. Who can anybody be? No.
I guarantee I could beat her.
So pull your finger outwards and then up. Yeah, look at that. That's 90 degrees. That's a little bit higher than this, huh? That's a little bit. That's a little bit higher. So that's what an adjustment does. It's your natural. My finger can naturally go to this range anyways. I just can't reach that range on my own. So what an adjustment does is it helps you reach that range momentarily, so that it has that motion, that range as is. Are we still filming? Are we good?
Yeah.
Cool.
Pause for a split second.
That's fine. So with joints, our back should be able to bend backwards and bend forward. We're very resilient, so we should be able to move. Totally normal. But sometimes you can't quite get that spot on your own. Some people go on a chair, kind of not that specific, but an adjustment kind of helps our joints really get to the entire motion. So we talked a lot. We're getting to the fun stuff. How we practice here, as I'm sure you guys saw today, you're going to see later today, you know, and we've talked about, is let's first get you out of pain. Pain is the first thing to come, last thing to come, first thing to go. So we're going to get you out of pain. But then we want to maintain good behaviors and good habits that keep pain from coming back. And lastly, we're going to solidify that. So I know you guys are really good on this. He needs to get on this. Nothing. And kind of from there, stabilize everything with good fundamentals. All right. So we're going to the Mackenzies. You can take this one. you have your mic? All right. Can we get a volunteer? Come on. Do you have any pain? Any discomfort we should know about?
My lower back.
I don't know.
Yes, in your lower back.
Oh, very mild with extended sitting. Look at that. So from today so far, what can you guys set it? Bring forward.
Probably that I'm hunching over the desk.
Discogenic. Good job. Discogenic.
All right. So with the
All right.
discogenic pain, go and have a seat.
Yeah, go for it.
Okay. So I'm going to walk you through one of the exercises that we like to teach here. And the reason why, for discogenic pain, what happens is that just from everyday sitting, everyday stress, bad posture, if we were a crazy kid, a lot of falls or a lot of, I don't know, like football or any sports or anything like that, it's a lot of wear and tear on your body, okay? So some people can have a disc bulge and maybe not have any symptoms at all, and some people can have a little disc bulge and have all the symptoms, right? So with this exercise, so as you can see right here, it's a little disc bulge, okay? Everyone? Yeah. So what happens with this disc bulge, it can irritate the nerve root, and it can cause that sensation down, okay? So what we're gonna do with this exercise, as Dr. Greg said, people don't like to bend backwards, we have pain. So we're actually going to force you into that position. And what happens with that is with the disc bulge, it normally bulges backwards. So as we start to go backwards, that feeling of that disc is going to kind of come back to where it's supposed to be. And it's going to alleviate that back pain that you do have, okay? So I'm going to have you go face down for me. Nope, sorry. I'm going to have you lay face down for me. Okay, so all you're going to do here, I'm going to have your hands right here. I want you to leave this nice and relaxed, okay? And all I want you to do is push your chest up, kind of like a cobra pose. Good, as high as you can. Kind of kiss the pain and then go back down. Good. Was that a little painful?
A little bit, yeah.
Okay, let's do about 5 and let's see if the pain kind of alleviates itself, okay? And I'm going to add some overpressure here in your low back. Go ahead. Good. 2. Good, and again. Good. 3. Let's do 2 more. Good. 1 more. Good. Is it better, worse, or the same?
I can't really feel it anymore.
Okay, good. So it got better. All right. So I'm actually going to have you do 3 more.
Okay.
Okay. So this is a position that we're not normally in when we're sitting down because we sit down for long periods of time. We have bad posture. So we're just kind of working those muscles, working those joints. Good. And good. And come back up. So that's something you can come up. That's something that you can do every day. You can do every morning or every night, just to kind of warm your back up, kind of get that discogenic like stuff in your back kind of back where it needs to be. Okay, thank you.
Oh, thank you.
Any questions about that?
Anything you want to add on that, Greg?
Are we still good? Cool. That was pretty much. Joseph, if you're not done yet, come back.
Oh, we're not done. Sorry.
No, you're good. What did you feel? What did you say? There we go.
Before it was like a little bit of a shearing.
Mm-hmm. What is shearing? Because people don't know what you're talking about.
It kind of felt like you guys know like Indian burns. Would you guys do that to each other?
Yeah.
I'm sure there's a better name for it nowadays, but it feels like that, but like on the inside.
Okay.
And as I did it, when I came up the first couple of times, I kind of felt it, and then the subsequent times, it was kind of like, oh, I don't really feel it anymore.
Yeah. So this kind of goes back to what I was talking about earlier with, if you do something and it stays the same, keep going. This is the exact reason why we would keep going. I think something feels better, great. Stays the same, keep going until it's either better or worse. How many reps until the pain went away?
By the third one, it was already
no, that's restored.
already being reduced. Yeah.
So this is the best thing that you guys can do for discogenic pain. Is the most common thing that we deal with, and this is, you come to see me, you come see her, you go see most any chiro worth their weight. They're gonna make you do this. This is like the best thing you can do. Thank you.
Okay. Thanks.
Thank you.
Next one. Any can I get a volunteer for the next one? Come on. Welcome.
Thank you, sir.
So this is going to be very invasive and difficult for you to do.
Okay, great.
Just kidding. This is arguably, this barely classifies as exercise. So what this is This is for people with that nervy pain. These people are going to have sharp shooting pain that goes down their legs. So let's say, pick a leg. Okay, so in this instance, our dear friend Jacob here has pain down the right leg. So if it's right-sided pain, and remember how we want to open up the holes, right? If it's right-sided pain, which side should be up, which side should be down on the table if he's lying on his side?
Open up the right leg, lean that way.
Very good. So can I get you on your side, facing the people?
I'm pointing to the left, by the way.
Good. You okay?
Yeah.
So this is the first starting position. Oftentimes it might be a little bit difficult. So what were the two things that we did? We wanted forward bending and side bending. What kind of bending do we have right now? Not much of any. He's kind of just lying on his side. It's kind of neutral. So let's make it some forward bending. So can you bring your knees as close to your chest as you can? Good. And I'm going to dangle it off the table. It might be a little uncomfy because there's a knob here.
Okay.
You okay? Not
Yep.
too bad? So now we have that forward bending, right? It's as if he's literally like this. And he has some side bending. With this arm, can you reach all the way over there? And this is the most, you feel stretch?
Yeah.
This is the best way that we can feel or get that side bending in his low back and forward bending. So people with really bad traveling pain, this is one of the best first aids that we can give them. We hang out in this position for 2 minutes. We just hang out. You can kind of do some overpressure to accentuate some of that side bending. And just hang out here. Any questions about this one? Really easy. Yeah, you can do this at home. Go ahead and come on up. If someone has pain and you need to give them home exercise, or if you guys are feeling that sharp shooting, stabbing pain going down your leg, if it's your left leg, which leg is up? Which side are you on? Which side are you lying on?
Your right side.
You're lying on your right side. And just dangle off the bed. How did you feel? What did you feel, if anything?
Well, I felt like stretching in that area,
Okay.
and I also felt like up here on my neck as well.
All right. That's weird.
Oh, nice.
All right. Any questions about this one? So for discogenic stuff, we have the ones that Joseph did, those extensions, those backwards bending. For nerve stuff, we had Jacob showing us on the side, leaning over. Thank you. All right, next up. Now, if we had to name a big three, what's a big three? Name your favorite big threes. Okay, J. Cole. Oh, Trinity's a good one. J. Cole, Kendrick. Yeah, Trinity followed by J. Cole, Kendrick, and or we got. You guys can't see Jordan, Pippen, Rodman, Ginobili, Duncan, and Parker, the Splash Bros, and Draymond. But my favorite big three, my third favorite big three, is the McGill's big three.
What?
The McGill's big three.
What is that?
I'm glad you asked. I'm glad somebody took the bait. Come on. You want to do the bird dogs. I didn't really do the bird dogs.
Huh?
They're not going to be nearly as good as yours. We need another volunteer. Let's go. Oh, you're volunteering for a good one. No, you're volunteering. Go up there.
All right.
No.
So I'm gonna have you go on all fours on the table. So hands and knees. Perfect. Okay. So the first thing we're gonna do is I'm gonna grab your hips. Okay. I want you to rock this way. No. Like rock
To
your
help your
hips. There we go. It's nice and tight core. Okay. I want you to keep this nice and stable. So we're working core, working back. Okay. So the first thing I want to have you do is reach out with your left hand. Good. And come back down. It's pretty easy, right?
Yeah.
Except you lost this. I want you to retuck your hips this way. There we go. Kind of like you're planking, right? Good. Pretty easy? Good. And back. Yeah? and now this arm. Good. Pretty easy?
Yeah.
Okay. Make sure you're breathing. Well, we're trying to make sure this stays nice and level, okay? So don't lose that tuck. There we go. Okay. So now, keeping your head in neutral position, keeping your arms still, because that was pretty easy. Keeping this nice and relaxed. Nice and tight. I want you to try and kick this leg straight back. Perfect. And bring it up a little bit. Good. So working the glutes, working the low back, kind of working all this area too. And back down. How was that? Ooh. Okay. So ideally, that was pretty easy. And you kept that core nice and tight. Tuck those hips again. There we go. And now do the same thing on this side. Good. Can you hold that? Where do you feel it?
Everywhere.
Everywhere. Perfect. And come back in. Okay. So if that's, I'd probably keep you there just because you keep losing this right here. I'll work on your core just a little bit. But a progression of that would be, go ahead and keep this nice and tight for me. Perfect. A progression to that would be, go ahead, I want you to lift this arm and this leg at the same time. Good. And back down. All right. If he was stable enough, we would go to the opposite side as well. So ideally, they would be able to do all four.
Both arms.
Yeah. Go ahead and relax. Go ahead and have a seat. So as you can see here, the bird dogs, these are the bird dogs. So ideally, you'd be able to keep your pelvis nice and tight, core nice and tight. You'd be able to do opposite arm, opposite leg. So it's a good way to strengthen your low back, good way to strengthen your glutes and your core all at the same time.
Yeah, and if you guys remember what I did for Danny when I kind of fixed off his hip, these exercises are going to help create the distraction that we're looking for. Marvin, you're not quite done. Come back. You're gonna talk about how you felt. Okay, this is a workshop. Sit down. It's okay. It's good. So, where did you feel the stress? Where did you feel a lot of the effort?
Lower back, core, and legs.
Look at that. All right, get out of here. Another volunteer. Who hasn't come up yet? Oh, I think we should stay down for the side planks. That'd be funny. All right, another volunteer. You can come for the next one. Nancy, come on. This one is really not that hard. Let's get you on your back. So another one. Yep, perfect. Obviously, as Marvin can attest. Yep, on your back. As Marvin can attest, that one is kind of tricky. It was hard, and we saw he even struggled to do it. I bet even if we got you to do it or you to do it, it would still be some. But there's progressions to everything. You can start with just in that position and keeping your hips tucked. And that can be it. And you hold that position for 30 seconds and come back out. For this one, it's going to be really nice and hard. Bend this knee. That's it. Put your arms below your low back. Good. Okay. Easy so far. Mm-hmm. Now in this one, a lot of people like to stress out their necks. They start straightening. All I want you to do, nice and relaxed, just bring your shoulder blades off the table. That's it. And back down. That's it. Okay. Back up. Yeah, it's not anything like Marvin's. Back up. Hold that. This is it. And you can see some shaking already. You can see some shaking. And back down. So this is the curl up. It's a much safer variation of the sit up. So sit ups, people are like, oh, I'm tweaking my backs all the time. Because discs don't like what movement? Bending forward. Right? So where in her low back? Go ahead and give me another curl up. No, joints don't like bending backwards. Ouch, joint. Ouch, disc. Got it? So same thing. Bring your shoulders up. Hold that right there. And they're going to hold you for 15 seconds. Where in her low back is it bending forward? It's not. But she's engaging her core. And then you can modify this by coming up a little bit higher, a little bit lower. But your low back is pretty safe. Go ahead and come on up.
Question. Why should your leg up?
So you would alternate 3 sets of 10 with your leg on each side. Why? Because it just biases the opposite side. With your leg out, there's more stress. And you can even progress this exercise to raising your leg up a little bit. So you're really engaging your core and you're kind of making like a V. How did you feel?
I felt like my core was engaged.
Good. How, any low back effort, strain?
No, I guess when I was coming up too high, my neck a little bit, but then after I kind of got the hang of it.
And I think I called it in the beginning, a lot of people like to strain their necks doing this exercise. Mm-hmm. Loosey-goosey. We just want to bring our shoulders off the table and then focus on the low back. Thank you. All right, now's the fun one. Daniel, get over here. This is all you.
Hi everyone. My name is Daniel.
Sit down, Daniel. This is going to be fun. So my brother's a big dude. He's a big dude. All right, so we're going to do a side plank. You know what that is? Okay, not quite. I love it though.
I tried.
You tried.
Okay, go home now?
No. So let's get on the side position. On the side. Good. What I saw, what did you guys see? He did it for like 10 seconds, but what did you guys see?
Model pose.
He kept his V, model pose. He kept his V, and he just came up keeping, he didn't actually activate his hips or his core or his low back. Come on. All right. So let's do it again. Try to hold it. So first, let's start with your Get your elbow under your shoulder, nice and tucked. No, right there. Hold on. There, good. Now I want you to squeeze your glutes and drive your knees forward. Drive your hips forward. Squeeze your glutes, come up and drive your hips forward. Good, and forward, forward. There you go. Looks pretty good. I'm impressed. Where do you feel that effort? He's like, can't even breathe.
Armpit.
All right, come back down.
My lat, kind of a little bit.
Okay. So this is great for, we know that in pain and the way muscles work, there's a lot of cross planes. So it's like right low back, left glute, right knee, left ankle. So it's a lot of cross patterns. So these side planks kind of affect some of that side pattern. We're now biasing one side. So sometimes side planks are kind of hard for people. Like he was holding here for like 5 seconds, is like starting to, doing a great job with it.
Soon.
Doing a great job with it. So there's some progression. So here's what we can do. So bend your knees both a little bit. Good, that's it. And this knee is just going to relax behind this.
Like under or behind?
Do you feel my finger here?
Like, am I numb or do I feel it? I feel your finger.
Okay, I want you to squeeze this finger into the table right here. So with this knee, squeeze the finger.
Not happening.
Good. And what I want you to do now is just pretend you have a flashlight on this hip and point the flashlight to the ground. Perfect. Look, and he's still shaking. So this is, if you can't quite do a full side plank, this is a great regression to come back and, all right. And remember, all you got to do is just, there's a spider, $1 million check, whatever, under this knee, and you press that bad boy, and there's a flashlight on your opposite hip. You're fine.
I was getting the check.
Oh. And there's a flashlight on the opposite side, and you just point it to the ground. Good. Doing okay?
Yeah.
Good, and coming up. And what did you feel where?
That's a good question. So, I felt obviously a core engagement, and at the same time, I felt a pressure in my neck from like, kind of doing. Sorry, I took your job for you for a second. Yeah, I felt a core engagement. I think that was it.
All right, thank you. Any questions about any of the exercises? Any of the, yes?
This might be a silly question, but for the curl up, so
Yes.
she put one knee up. Does it matter if you put both at the same time, or does it have to be one at a
So
time?
technically, it doesn't really matter, but McGill, the guy that kind of founded these 3 exercises and bred them together, he suggested one leg because, I'm going to do it so I better articulate it. So with this knee up, one, there's less neural tension on this side. We didn't really go into that, but take my word for it. And if we switch, not only does it affect just fascial tensions in our low back, but it also affects hip movement and the area of where everything is. So in this position, my hips are kind of tilted a little bit, and now we're engaging the musculature in a way that is dealing with those changes. So ideally, we would alternate the sides that the knees are up. Yes.
When he was doing the side bridge, he noticed some tension in his armpit, and I question: is that because he was doing it wrong, like focusing the stress in the wrong spot, or he was compensating because that was a harder variation, or is that just fine?
I can answer that from my perspective. I felt like at first, when he didn't tell me to squeeze my butt and drive my hips forward, I was using my lats to prop my body up. And that was like, almost like a pull down, like I was in that movement, and I was keeping my arms steady that way, as opposed to using my core to go up.
Once you had corrected yourself, you felt better in you felt like it was engaging more in your core?
Yeah, one thing I might probably do in the future would be put something on my neck, because when I was like this, kind of using my body to go forward, I was pinching my neck, but if there was like a pillow there or something, it would have been completely fine.
So one thing though, with the side bridge or side plank, we want your neck to be in tandem with the rest of your spine. So we wouldn't want it like resting on a pillow and then like this, and the rest of your spine is like that. You'd be ideally holding your head up. It's a tough exercise.
So I need more practice.
Yep. Any other questions?
I have a question.
I hopefully have an answer.
For your McKenzie's,
Yes.
you said it's for discogenic pain.
Yes.
Can you also do it for nerve pain?
Yes. Great question. So do you guys remember what I said about exercise and pain? When to keep going, when to stop?
Mm-hmm.
When?
So if it doesn't change, keep going. If it gets worse, keep going for a little bit.
Good.
And then stop.
So Mackenzie's is pretty much the same thing as you're doing them. So I'm gonna actually, Fedi, you haven't come up yet. Let's get your face down. We're gonna give a hypothetical scenario to Fedi here. Fedi is a 33-year-old, depressed, office space worker. Let's go face down. And he's coming in because he got crazy left leg pain that just shooting down to his ankles. So we're gonna do some of those extensions, okay? So we're gonna be like, all right, you got some radiating pain. This is the first thing we're gonna do. So let's do 5, or let's do 2, and we'll say that it's 10. So do 1. Good, and another one. Good. And after doing 2 sets of 10, he's like, my ankle pain, my pain doesn't travel as far anymore. It's now kind of in my hamstrings, but the intensity is a little bit worse. That's fine. And then he does do 1 more. So we did another 2 sets of 10 and back down. Okay, now the pain isn't in my glute, is it in my hamstrings? It's now kind of in my glutes, kind of in my low back. But the pain intensity is getting worse. Do 10 more. So just do 1 more. Good. Yeah, doc, all the pain, okay, you can relax. All the pain is right here. It's a little bit worse than when it was dispersed. That's fine. We want things, because remember, this is a nerve root or discogenic pain generator. The pain is coming from the low back. We want the pain not to be as traveled as far down. We want it to be going back up. So even though the pain intensity is getting worse, the length of the pain is less, we're happy. Now, let's say we did these extensions and it's like, do 1. So he does this, come back down. It's like, we did 2 sets of 10. Doc, my pain's almost all gone, but now I feel it in my big toe. But the intensity is so much less. We want the pain to consolidate and centralize back towards the middle. So for nerve-related and discogenic-related pain, absolutely you can do these extensions. And you can determine, is it going to the back? Great. And then once it's back here, then is it really now still the nerve root, or are there other tissues involved? Is it the joints? Is it the musculature? Is it other things that we may not have been able to deal with if it was all the way down the leg? Does that answer your question? Anything you would like to add?
Perfect.
Thank you, Fedi. Didn't come out. Any other questions? Let's go get Taco Bell. Sounds good.